One of the other things that's been happening a lot recently is the rise in TRT usage among young men, maybe in part due to hoping to elevate their mood, to improve the way that they feel. What's your opinion on what appear to be increasing numbers of young men using TRT?
I'm greatly concerned by it, truthfully. I think it's, I think, again, a lot of men, I think, don't understand the risks of TRT. And while testosterone is a very safe therapeutic, I mean, if done correctly, it's as safe a hormone as there is. But, you know, if you're talking about a young guy who doesn't actually understand the impacts of testosterone on fertility, for example, later in life, doesn't understand what a physiologic dose is versus a super physiologic dose, and especially in the cases where guys have to get this stuff illegally, then you introduce a whole new layer of contamination and all sorts of things like that. So net, I'm a little concerned, maybe a lot concerned. I also think, you know, there are lots of clinics opening up that are kind of trying to circumvent some of these issues. And again, I think their motivation is to capitalize on an obvious interest, but they do so without, necessarily a nuanced approach to how to do this.
Take me through the risks of TRT. What are they, high level?
So it depends on if we're going to talk about TRT done correctly. Do you mean literally TRT, testosterone replacement therapy, or
that and its more malignant offshoots where people start to push dosages and stuff? But take us through, the range.
Well, I would say let's start with what's sort of known in the medical world, right? So we'll start with kind of appropriate physician-administered testosterone replacement therapy.
For an appropriately aged individual.
For an appropriately aged individual at an appropriate physiologic dose.
Cool.
Okay, so the two big risks that people have historically been concerned with are prostate cancer and heart disease. So an increase in the risk of prostate cancer and an increase in the risk of cardiovascular disease. Both of these have been studied extensively, and I think we can make a very strong and compelling case that testosterone replacement therapy is not increasing the risk of prostate cancer at all, and it may in fact be decreasing the risk slightly. I've done an entire podcast, I think 2 podcasts on just that topic. That's how nuanced it is. But again, to give you just one example, when we have a guy who has undergone a prostatectomy for prostate cancer, he's had his prostate removed, we will still use testosterone replacement therapy in that guy. So think about that. You have a guy who had prostate cancer, you will still give him testosterone replacement therapy if it's warranted or indicated post-prostatectomy. Now, do you do it and shut your eyes and never look again? Of course not. You're still monitoring his PSA every 3 months, and you're going to look for any sign of recurrence. And if there is, in fact, a recurrence, you would immediately cease it, because what we do know is testosterone would feed prostate cancer. But the point I'm making is around initiation. Is there any evidence that testosterone replacement therapy initiates prostate cancer? The answer is no, there is not. And there is some evidence to the contrary. The cardiovascular disease question is a little bit more difficult, and the data are a little bit more muddled, but on balance, they come out in the direction of TRT does not increase the risk of cardiovascular disease. Now, there's a big trial that was completed last year called the TRAVERSE trial that gave men androgel, so topical testosterone, and followed them for, I want to say, 3 or 4 years. And there was no increase in the incidence of ASCVD, atherosclerotic cardiovascular disease. But there is, so at face value, that study was taken to mean, look, we have one more study, the biggest and best, that demonstrated no increase in the risk of cardiovascular disease with TRT. So the debate should be settled once and for all. I did a podcast on this, wrote a long newsletter on this, and the long and short of it is in my view, that's a slightly premature conclusion, because I don't think the TRAVERSE study was done perfectly. Most importantly, it did not give men a high enough dose, in my view. So the men started out very hypogonadal with a total testosterone of somewhere between 1 and 300 nanograms per deciliter, but they were only replaced to about 600 nanograms per deciliter. And while that's a reasonable rate of replacement, I don't think it represents what's happening in the world. I mean, we replace patients to higher than that. We replace patients to 800 or 900. We're technically tracking free testosterone and not total testosterone, but usually to get somebody in the range of where we think a good free testosterone is, we will see a total testosterone that's easily in the 800, 900 nanogram per deciliter range. So it's possible the TRAVERSE trial only answered the question, does low dose, or as one of my analysts put it, does testosterone light replacement therapy increase the risk of cardiovascular disease? And I think there we can say the answer is probably no.
Okay, and what about testosterone replacement therapy when it's done badly?
Yeah, so I think if you even think about it in the medical setting, I think testosterone can be given to very superphysiologic levels, and I see patients getting superphysiologic levels all the time. They come into our practice, they've been treated at some T clinic, and they walk in with a free testosterone of 35 nanograms per deciliter, which is like twice what you would consider reasonable. And part of the problem is we don't really know what everything goes out the window with what I said earlier. Now, can I say that that doesn't increase the risk of prostate cancer initiation? I can't say that because I don't have the data. Can I really say that doesn't increase the risk of cardiovascular disease? No, I can't. It's also, by the way, creating a lot more erythrocytosis. So these people are making red blood cells at an alarming rate, and they need to be monitored very closely for increased blood viscosity.
Is that, I have a friend of a friend who donates blood every month.
Yeah,
is that
that's why?
Because they're just making too much and it's too thick?
Correct.
Wow. I mean, good for the blood donation people.
Yeah, and again, the question is, if you have to give blood every month, if your bone marrow is so revved on that you have to give blood every month, do we run the risk that you're going to convert into polycythemia vera at some point, which is a disease now where all of a sudden you can't shut that process off? So,
it becomes self-sustaining even once you've come off the TRT.
Yeah, again, I'm not suggesting that that's happening. What I'm asking is we don't know, right? And there's just a big unknown there. The other thing is once you start to get into these super physiologic doses, you start to run into other issues around a lot of estrogen and a lot of DHT. So you'll see these men who are on these super physiologic doses of testosterone also showing up on 5-alpha reductase inhibitors, which we could talk about why I'm not a huge fan of those, and on aromatase inhibitors, which I'm also not a fan of.
Is that to stop gyno and hair loss?
Yes.
Right.
And obviously I'm not a guy who takes hair loss very seriously, but I think it's a mistake to take a 5-alpha reductase inhibitor for hair loss. I think there are far better strategies if it matters. And I think, even though the risk of finasteride syndrome or post-finasteride syndrome is low, it's not zero, and it's potentially irreversible. And this is, I think, in a young man taking finasteride, again, if you're listening to this and you're on finasteride and you have no issues, you're fine. It's something that if you hasn't kicked in within, 6 months, it's not going to kick in. But we do see men who have like a permanent loss of libido. This is reported in the literature.
That's what finasteride syndrome is?
Yeah. So basically there's something about blocking DHT that might not be a great idea.
Permanent loss of libido would be bad. What else haven't we spoken about when it comes to exogenously increasing testosterone levels? Fertility?
Yeah, well, there's another thing that I think is fertility for sure, right? So once you give exogenous testosterone, you're going to cut down on endogenous production, including sperm production, and therefore you're going to see a reduction in fertility. And at some point that's retrievable, and at some point it becomes more and more difficult to retrieve. So it depends on the person's age when they start and what their testicular reserve is, but generally speaking, 2 years of exogenous testosterone can spell the end of endogenous production and therefore a lifetime dependency, which again, we do that all the time. Like if a guy is old enough and decides it's time to go on TRT, we fully accept that. And there's no risk of being on lifetime T for life within physiologic doses. But for a guy who's young, that might be an enormous risk. And we see this all the time where guys who are doing this in their 20s decide they want to have kids in their 30s and they can't.
What else haven't we said about the risks of TRT?
I think there's another method of delivery using clomiphene and clomiphene. And these are drugs that have the advantage of preserving fertility. They work by inhibiting estrogen receptors in the hypothalamus that trick the brain into thinking you need more testosterone. So now the brain, via the pituitary, starts producing more follicle-stimulating hormone and luteinizing hormone, and you end up increasing endogenous production. And again, I might be an unusual skeptic in this regard, but my concern with that approach typically centers around, yes, you raise testosterone, but are you getting the full benefits of testosterone? Because I think one of the benefits of testosterone is the benefit in the brain. And if you're now blocking estradiol's impact in the brain, certainly anecdotally, there's questions about whether you're taking away some of the benefits of testosterone, including mood and libido.
Would you have any concerns for people being on Clomid for a long amount of time? Is that something that you think shouldn't be used?
I would feel very strongly about people not being on clomiphene or Clomid for a long period of time for another reason, which is it really increases the production of a sterol called desmosterol. And the reason for that, there's a lot of problems with that, including potentially an increase in the risk of atherosclerosis, increase in the risk of cataracts and things of that nature. So I think long-term use of clomiphene is probably not a good idea. The drug was never intended to be used long-term. It's a fertility drug, so it's intended to be used short-term. And I think short-term rises in desmosterol are not problematic, but lifetime increases or many years of increase, I think, would be. And there's a drug that increased desmosterol levels in the 50s and 60s that was actually pulled from the market because of the increase in cataracts and the increases in cardiovascular disease.
In other news, this episode is brought to you by Maui Nui Venison. Maui Nui delivers the healthiest red meat on the planet directly to your door. First off, the venison sticks are seriously delicious, not gamey at all, and unbelievably convenient to eat. No one accidentally hits their protein goals, and these little puppies will help you throughout the day. If you're traveling, if you're on the road, or if you're just a rushed human like the rest of us, these things will help you to hit your protein goals and ensure that you're getting good quality meat throughout the day. Not only do they provide the most nutrient-dense and high-protein red meat available, they're the only stress-free 100% wild-harvested red meat on the market. Also, they're actively combating the environmental destruction caused by Maui's axis deer overpopulation, which literally looks like a wildfire from above. So by eating meat, you're actually helping the environment. Get 20% off your first order by going to the link in the show notes below or heading to mauinuivenison.com/modernwisdom using the code modernwisdom at checkout. That's MAUINUI venison.com/modernwisdom and modernwisdom at checkout.